students.
Good morning, miss.
Okay. How are you finding the classes?
We are good. How are you?
How are your classes? The last class you visited, how was the class?
Good. Good. How are you, miss? How was the class?
And did you get the PPTs on workplace?
They still didn't receive emails apparently.
But they have been registered actually.
Sorry?
No worries, you do this one thing. Send me their email IDs. I think they have been registered already. Mr. Isdor gave their email IDs actually.
Yeah.
No worries, we will also do a cross check again. And so today he is going to start with the bathing techniques for the patients. I will hand over the mic to Mr. Kumud now.
The English is confusing. The English is confusing. Yeah. How was last class? It's like how was the class? How was last class? Not English.
Is the PPT visible to you?
Hello. Yes.
Okay.
Yeah, it's visible.
We will start now. Assisting in bathing techniques for the patients.
Good morning, students.
Good morning, sir.
Yeah. So today we are going to discuss a new chapter, assisting in bathing the patient in a hospital. This is a technique to provide the bathing to the patients. For different patients, the different techniques of bathing are there. We will discuss all the bathing process in details. First, we will discuss the patient's hygiene need, the equipment which required to maintain the hygiene in a hospital for the various patients. The first one is a large ball which contains warm water. The water with the adjustable temperature to the patient comfort. The temperature of water must be adjusted to the comfort according to the patient. Then the second one is soap, which is regular or non-regular rinse soap. It depends on the various types of patients admitted in the hospital, which kind of soap they are using is better for them. The separate washcloth for the patient and the sponges. Then dry towel, lotion, comb, hot towel, face towel, bed linen, or clean cloth. The towel must be separate for the face or the bathing purpose. The towel which is used to wipe out the face of the patient that is not for the purpose of bathing. That is only for the purpose of wiping the face of the patient. You can see here, this is the ball with warm water. This is soap. This is a sponge which used for scrubbing the body. This is the linen which are being used if in case of the patient is not able to leave their bed or during giving the bed wash. This is kind of lotion, comb, towel, clean cloths or linen. These are the various equipments which we need during the patient bathing to maintain the hygiene. Did I finish it up? Now come to the procedure of giving bed bath. There are various bathing procedures for the different patients. In case the patient is unable to leave their bed in a hospital or not move properly, in that case we have to give the bath on their bed only. While giving the bed bath, you must ensure that the fan, air conditioner must be switched off so that the patient does not catch cold during the bathing process. While giving the bath, you must ask the patient for urinal or the bedpan if required before giving wet bath to minimize the disruption or discontinuation during the bathing process for such patients. As we told that the water must be warm, not the normal or cold water used during the bathing. Must use the warm water, which is comfortable or adjustable according to the patient comfort, so that the patient does not catch cold. While starting the bed bath, you need to arrange or prepare all the required items very near to the bedside where you start giving the patient bed bath.
उनका वेटिंग है स्लो रिप्लाई करता है बोलेगा तो नहीं
If you start the giving bed bath, meanwhile you do not have to go anywhere for any required item, so that you have to arrange or prepare all the items within your reach.
আসেনি আমি সেখানে পরিষ্কার বলছি যে তোমার এখানে কল ওয়েটিং এ আছে সেটা দেখতে পাওনি চেক করো যে পুরনো মেশিনটা যেটা আগে তুমি পাঠিয়েছিলাম
The bathing is very important for the patient who is unable to move within the hospital. So you need to be keep patience during giving the patient bathing. Do not show any hurry or not conduct the bathing in any rush.
সিস্টেমে হিসাব রাখছো তো
While giving the bathing, you must ensure the condition which patient feels comfort or patient allows. According to that, you need to give the bath to the particular patient. We wrote it down.
Yes.
Any confusion? Any doubt?
Your team.
Okay. These are some other points while you have to keep in mind during giving the patient bathing process. The area which required to give the patient bath, you need to expose only that area, not whole the body. If you giving the bath the lower portion of the body, you need to cover up the upper part of the body. And you also need to make the patient feel comfortable by talking during the process. You need to talk while giving the bath to the patient so that they must feel comfortable. You need to start the bathing process from washing and drying the face first, then come to the neck and ear, followed by chest and arms. Continue with the lower parts of the chest, abdomen, side of the body, followed by the umbilical or lower limb. This is the correct process while giving the patient bathing. Just you need to start from the face, followed by the lower part of the body. In case the patient is unable to sit or leave the bed, you need to turn back patient or turn in front to the areas and clean them or wash them properly. After giving the bath, you need to change the linen with the bed linen with a clean one, and if necessary, wash the inner parts of the body of the patient. Dry all those areas immediately after bathing process, and you need to pay attention while giving the bath, because there might be some area of the body or skin which seems to be uncomfortable or unreasonable, like it's become red or it's become skin folded. In that case, you need to inform the treating doctor that such patient is having such infections inside the body on the skin, so that the doctor look after the patient and provide the medicine accordingly, so that the infection might be in control or could be prevented for that patient. While giving the bath, you need to keep in mind that do not show any rush or any hurry with the patient, because the skin area for the sensitive region might be harassed, so that it might occurs with some other skin problem. Then you need to apply a lotion according to the body of the patient or the condition of the patient to keep the skin soft or supple. Apply it in a very less, not use the excessive amount of the talcum powder or the lotion, so that the skin become dry or itchy. That might again the parts of the body may lead to skin infection. There are some guidelines to follow before giving the bed bath. For GDA especially, just you need to write down all these points. These guidelines are based on the bathing techniques or the process which are discussed in the previous slides. Like you need to politely explain whatever he is about to do or you are going to do with the patient in case if he or she is not in a full conscious. According to the patient body condition, you need to clean the area with the obstacles. If patient does not move properly or sit properly, so you need to help out the patient according to their condition, and you always need to convey the patient the message what you are going to do the next. Then the area where you are giving the bath to the patient must be warm. It must be free from the air condition or the fan. If the air condition or fan is running, you need to switch it off before starting the patient bath. And the required equipments must be within your reach so that you can not leave the patient during the procedure. If you leave the patient for any reason, then it might patient may suffer with the cold or with any another problem. So you need to ensure all those equipments or the things which requires during the bath must be within your reach. You need to use sheet while giving the bath, sheet, towel, blanket to cover the patient body so that the patient does not suffer or feel cold during the bath. These are the important guidelines for the GDA. While giving the patient bed bath, you must have to keep all those things in your mind while starting the procedure of bathing. Did you complete it?
Yes.
Okay. For the elderly patient or the aged patient, you need these steps while giving the bed bath. Choose the disposable basins or dispose after one use to reduce the risk of contamination. While giving the bed bath to the elderly patient, you need to use the disposable basin, and you must ensure that basin must not again used for giving the bath to the another person. So the risk of infection or chances of contamination with the one patient infections to the other patient can be prevented. The soap or the lotion which are being used for elderly patients must be pH balanced, cleanser, so that do not need to wash with a heavy amount of water. Use pre-packed bathing product to reduce the process variations. The pack which contains all the bathing equipment that must be used so that the reduce the time, the variation during giving the patient with bath for elderly patient. In this case also you need to report any abnormalities found on the patient body, like giving bath to the other patient. If there are any kind of abnormalities on their bodies, in a skin of the various parts of the body, in this case also you need to report to the treating doctor so that the doctor can prevent that by giving the proper medication. For elder patient, the important point is you need to give the back massage or the back rub so the blood circulation of the body could be maintained while giving the patient elderly for the bath. By giving the massage or the rub on the back of the elderly patient, the circulation of blood must be flowed regular, which needs during the treatment, because the good blood circulation helps in the speedy recovery while treating the patient in the hospital. Okay, it is clear?
Yes.
Okay. Then these are the points for giving the bathing to the injured patient. You need to write down, note down all those things, points. In case the patient is injured, the arm, shoulder, they start removing coat from the injured side. To remove the coat, unbutton the strap. Excess material under the back towards the far shoulder. To remove the clothes, the wrist tie, keeping the patient covered with the sheets. These are similar process with mild different with the normal patient that you need to give the bathing to the injured patient in this way.
Sorry, we did not finish.
Okay.
We are done.
Okay. So this is the end of this chapter, the bathing process or assisting the patient while giving the bath in a hospital. For various patients, you need to keep all these points in a mind while giving the patient bath within the hospital. We will start the new chapter. The new chapter is assisting in grooming the patients and maintaining hygiene in the hospital. Is the PPT is visible?
It's still loading.
Okay.
Yes, it's visible now.
Okay. So this is the new chapter with assisting the grooming patients and maintaining hygiene.
অন্তদা তো পাঠিয়ে দাও না
Patient grooming needs.
বলে দিচ্ছি আর শোনো না
These are the main points you have to keep in mind while groom the patient.
একটু দেখো না
One is bathing, dressing, shaving, and the skin care.
আমি বলে
The
দিচ্ছি
bathing
দাদা,
technique
তোমার কাছে
we have already discussed in the previous chapter. Why we are giving the bath to the patient? Because to cleanliness and maintaining the hygiene in the hospital, or also preventing the infections during the hospital stay of the patient. After giving the bath, you need to dress up the patient properly, so he or she looks good or energetic or full enthusiastic, so that the another is shaving. The shaving, you need to shave the patients regularly, so that the proper skin care or the look of the patient must be seems a good while stay during the hospital. Because why grooming needs to maintain for the patient? Because if we groom well, it's depend on our personality or the grooming gesture that the other people in the hospital, like the staff, the other patients, they also feel the comfort and the rich environment within the hospital, so that each and every patient is well groomed, well shaved, well dressed up, and the skin care like regular bathing, applying the talcum powder or the lotions to the skin, so you could prevent the skin infections in a various way. So these are the points which is very important during the hospital stay, because patient need to be in a good condition or looking good while staying in the hospital, so that the environment of the hospital much better for the everyone. Clear? Any doubt?
No doubt.
Okay. So these are the guidelines while you are grooming the patient or maintain the grooming of the patient in the hospital. Just you need to write it down and follow these guidelines while you start working in a hospital. Yes, you need to apply all these points or the study materials at the time of your work with any hospital in your country. Always preserve the modesty of the patient by not undressing unnecessarily. So undressing the patient unnecessarily, or if not required, do not undress or put out the clothes of the patient, because it's not looks good. Patient also might feel uncomfortable. The second one is important. Close the doors and draw the curtains when undressing the person. The privacy of the person must maintain while grooming, while giving the bath, while shaving procedure, while skin care. Each and every procedure must be done with the privacy of that particular person or the patient. Keeping room in a warm condition or the temperature which is comfortable for the patient, with that do not show any hurry or any rush while giving the procedures to the patients. Be polite or gentle while the movement of yours and as well as the movement of the patient's body for removing or pull up the cloth. If the patient is not physically fit or the some area parts of the body is disabled, then you need to dress that part first, so that the undressed areas or the part must be done later after giving the cleanliness or dress up the disabled limbs or the part of the patient. Okay, so you have completed. These are some guidelines while the patient is having the IV line. What is IV line? Just you can see here, the patient is having IV line, inserted with IV lines. That IV lines is a set of that needle and the IV set which inserted in the veins of the patient for giving various injections or salines during the treatment. You can see here, this is a small IV set which is inserted in the vein of the patient. So, for such patient, if you dressing up this patient, you do not pull off this IV set. This is a fit for the patient during hospital stay. You cannot pull off this IV line every day and insert again and again to the patient. It's damage the vein of the patient. So it's inserted once when patient is admitted to the hospital, and according to the requirement, if the requirement of this IV line seems to be completed, then only it can be pulled out from the veins of the patient. So, while dressing such patients, you have to be very careful because it might be damage the veins or the area of the patient which the IV lines have inserted. So you have to be very careful while dressing up such patients that this area must be protected or not get damaged at any cost, because the damage of IV lines or the damage of veins, it must suffer the patient in heavy bleeding, which may lead to the death of the patient. Might happen in such case if the IV line is get damaged, then the patient might suffer or heavy bleeding and leads to the individual death. So you need to consult the physician or see the treatment plan of such patients, and the wound area of such patients must be taken care by the specialized physicians. You need to provide the education and the movements of the wound patient and the instruction for that to the patient properly. In such case, if required, the physical therapy must be provided to improve the movement or the mobility of the patient. Food or any intake which is taken by the patient must be according to the plan of dietitian. During hospital stay, any kind of food or the eating thing which can be eaten by the patient must be according to the advice of dietitian, so that the good health of that particular patient is maintained during the hospitalization. You complete it down, then we will move to the next slide. You completed?
No, wait.
Okay.
Done.
Then we come to the oral care for the patient within the hospital. while giving the oral care, you need the equipment as per the condition of the patient, of the body or the requirement of the patient. You need to use either electric or the manual toothbrush or a foam brush. It depends on the condition of the patient or in which the patient feels comfortable. Then the toothpaste, dental sticks, floss, the apron or towel for the protecting while giving the oral care. So the other part of the body must be prevented to get dirty. A cup of water for rinsing after the toothbrush or giving the brushing. A separate cup of separate set of cup or wall which holds the patient's saliva during giving the oral care to the patient. So the patient must throw the all saliva or the waste materials with the help of GDS in that particular wall or the cup. Water waste reform or the moisturizer must require during the oral care, because after giving the oral care you need to apply a lip balm or the moisturizer to that particular patient. So the moisturizer must maintain the GDA must follow these steps while preparing the patient for oral care. Ask them why they can move into an upward right position or not. If patient is able to move upright position, then you need to help them in the sit-up position. Turn the patient head in a side way for any kind of lie flat or choking during giving the procedure. You must need to side the patient to one particular side to the bed. You need to place the apron or towel over the patient's clothes so the other body part or the rest of body must be clean, or you do not need to clean them again after giving the oral care to the patient. So the proper apron or towel must be covered the below part of the neck of the patient. So you complete it and let me inform.
At that,
Then brushing the patient teeth, you need to follow these steps while giving the brushing to the patient teeth. You need to clean the proper area of the mouth while brushing the patient. Clean the inner outer top surface of the patient teeth. You also need to brush the gum and the top of tongue so it can prevent the mouth of the patient from the ulcer. You need to use the foam so the softness of the mouth or the cleanness of the mouth must be maintained. And give the water to that patient so they can properly split the foam or the water in the bowl or cup. So the cleanliness of the mouth must maintain with providing the proper water while brushing the patient. Then come to the patient oral care for the patient who is using the dentures. The dentures is used by the patient who misses their some teeth. For such patients, the artificial teeth are used which is called dentures. For such patient, giving the oral care, you need to follow the digestive. You need to remove or pull out that denture from the patient mouth, then need to clean them and put back inside the mouth. The brush which is using which are being used for cleaning the dentures must be separate from the other toothbrush or the cleaners or the toothpaste, that all are the separate from the regular oral care patients, so that the infections can be prevented for the patient who is using the denture while hospital stay during his or her treatment. That must be used with the help of warm water, not with the cold water. The denture must be